Think about your morning for a moment. Your alarm rings. Before you reach for your phone, before you make your coffee, before you even greet anyone in the house, what is the first thing your body seems to make you do? You clear your throat, and then you do it again. But here is something most people have never been told. That automatic little habit you have been repeating every morning without giving it a second thought could actually be one of the reasons your mucus keeps coming back. Before we get into the 5 causes, take a second and tell me in the comments your name and where you are watching from. I genuinely want to know where everyone in this community is joining from. Now, before we discuss why your throat may be producing so much mucus, there is something important you need to understand about how mucus normally works. Your body produces mucus continuously. Every hour of every day, your airways are making it. In a healthy throat, this mucus is usually thin, clear, and almost impossible to notice. You swallow it naturally dozens of times throughout the day without even realizing it. That is exactly how the system is designed to work. But as we get older, something changes. There is a process called mucociliary clearance. Along the lining of your nose, throat, windpipe, and other parts of your airway are millions of microscopic hair-like structures called cilia. Think of them as tiny, moving brushes. Their job is to keep mucus traveling in the right direction, constantly pushing it upward and outward like a miniature conveyor belt operating around the clock. When you are younger, this system generally works efficiently. Mucus gets moved along before you have any reason to notice it. But research on aging has shown that cilia function can decline over time. By the time many people reach their 60s and beyond, the speed and efficiency of mucus clearance may be reduced. Mucus that once disappeared without you noticing can begin to remain in place longer. It becomes thicker. And eventually you feel it. Here is where the problem can become a frustrating cycle. The moment you feel mucus sitting in your throat, what is your natural reaction? You clear your throat. Usually you do it forcefully, but repeated forceful throat clearing can irritate the delicate lining of your larynx. That irritation can create a small amount of swelling, and your body may respond by producing additional protective mucus. You feel the mucus. So you clear your throat again. That irritates the tissue again. More mucus appears, and you clear it again. It becomes a loop. This type of cycle is associated with laryngeal hypersensitivity, a mechanism increasingly discussed in the evaluation of persistent throat symptoms. Your throat may not necessarily be producing excessive mucus because there is a major problem with the mucus itself. Sometimes the repeated attempt to remove it becomes part of the problem. Understanding this cycle is important because each of the 5 causes we are about to discuss can contribute to it in a different way. Before we continue, make a quick guess. How many times do you think you clear your throat during an average day? 10 times, 20, 50, maybe even more? Put your best estimate in the comments. You may be surprised once you actually start paying attention. Now let's get into the first cause. And this is one that many older adults have never connected with their daytime throat symptoms. It has nothing to do with the food you ate yesterday. It may not even have anything to do with your sinuses. It can begin while you are completely unconscious. Cause 1, nighttime mouth breathing. The overnight trigger. Let me ask you a simple question. When you wake up in the morning, does your mouth feel extremely dry? Not just slightly dry, I mean genuinely parched, as if you have spent the entire night breathing through your mouth. If that sounds familiar, pay close attention because your breathing pattern while you sleep could be contributing to the throat symptoms you experience during the day. As we age, the nasal passages can change. The tissues may become less flexible, and nighttime nasal congestion can become more common even when you do not have a cold. If the nose becomes partially blocked during sleep, your body may automatically switch toward mouth breathing. And you might have absolutely no idea that it is happening. This matters because your nose has an important job beyond simply allowing air to enter your body. It helps warm and humidify the air you breathe. When air passes through your nasal passages, it is conditioned before reaching your throat and lower airways. But when you breathe through your mouth, that conditioning process is reduced. Dry air can travel directly across your throat for hours. Think about what happens to your skin when it is exposed to cold, dry air for a long time. It becomes irritated and dry. Your throat can respond to prolonged dryness in a similar protective way. The mucus-producing cells in your airway may increase secretion to help protect and recoat the irritated tissue. And what happens the next morning? You wake up with that familiar thick coating. You feel heaviness in your throat, and almost immediately you clear it. That first throat clear can become the beginning of another cycle. Nighttime mouth breathing can also be associated with sleep-disordered breathing, including obstructive sleep apnea and other forms of increased airway resistance. This is one reason persistent morning throat symptoms should not automatically be dismissed as normal aging. Ask yourself a few questions. Is your throat much worse during the first hour after waking? Does it gradually improve as you drink water throughout the morning? Do you frequently wake with a dry mouth? Does anyone who sleeps near you notice that you breathe through your mouth or snore? These clues may help you recognize a nighttime breathing pattern. There is another factor worth mentioning. Alcohol close to bedtime can relax the muscles around the throat and soft palate. For some people, this may make nighttime mouth breathing or snoring more noticeable. So if you regularly have 1 or 2 drinks in the evening and consistently wake up with a dry, coated throat, that timing may be worth paying attention to. If this sounds familiar, type breathing in the comments. Now, what we just discussed happens while you are asleep. But the second cause is happening while you are wide awake, and it may be happening inside your own home every single day. Cause 2, indoor air quality. Could your home be irritating your throat? When was the last time you seriously thought about the quality of the air inside your house? When people hear the words air pollution, they usually picture traffic, factories, smoke, or city smog. They rarely picture their bedroom, their living room, their kitchen. But indoor air quality can matter, particularly for people who spend a large portion of their day indoors. The Environmental Protection Agency has reported that indoor pollutant concentrations can sometimes be significantly higher than outdoor levels. And for older adults who spend many hours inside their homes, continuous exposure can become especially relevant. Let's look at 3 things that can contribute to persistent throat irritation. First, humidity. When indoor air becomes excessively dry, especially during colder months when heating systems are running frequently, the moisture in the membranes lining your nose and throat can decrease. The mucus can become thicker. Your body may respond by producing more mucus to protect those surfaces. That feeling of having something coating the back of your throat may actually be part of that protective response. Second, volatile organic compounds, often called VOCs. These are chemicals that can be released into indoor air by a variety of household products, scented candles, air fresheners, some cleaning products, certain paints, synthetic materials, some types of furniture and flooring. These compounds can contribute to airway irritation in sensitive individuals. And because the exposure can happen repeatedly, you may not recognize the connection. Third, and this one surprises many people, is mold. You do not necessarily need to see a large patch of obvious mold on your wall. Microscopic mold spores can exist in damp bathrooms, basements, around appliances, inside air conditioning systems, or in other areas where moisture accumulates. For susceptible people, inhaling these particles can contribute to upper airway irritation and respiratory symptoms. The reason environmental triggers can be so difficult to identify is that they are often constant. You do not experience one obvious exposure followed by an immediate reaction. Instead, your throat may remain mildly irritated day after day. Eventually, the irritation starts to feel normal. Here is a simple question you can ask yourself. Have you ever traveled for several days or stayed somewhere else and noticed that your throat suddenly felt better? Then, after returning home, did your symptoms come back within a day or 2? That pattern does not prove that your house is the cause, but it is certainly a clue worth investigating. You do not necessarily need expensive equipment. A basic humidity monitor can give you useful information. Check your bedroom. Check areas of your home where moisture is common. Look for musty odors. pay attention to excessive dryness, and make sure air filters and cooling systems are maintained properly. The first two causes we have discussed are environmental, but the third one comes from inside your body, and it involves an organ that many people would never think to connect with chronic throat mucus. Cause 3, thyroid function, the connection. Many people miss here is something important to understand. Thyroid problems become more common with age, and some people have mild thyroid dysfunction without realizing it. The thyroid is a small butterfly-shaped gland located at the front of your neck. It produces hormones that influence metabolism throughout your body, your heart rate, body temperature, digestion, energy levels, mood, and many other processes. Thyroid hormones can also influence systems involved in airway function and mucus clearance. Remember those tiny cilia we discussed earlier? They help move mucus through your respiratory tract. When thyroid hormone levels are low, many processes throughout the body can slow down. For some people, this may contribute to reduced mucus clearance and increased throat symptoms. The challenge is that thyroid problems in older adults do not always look like the textbook version. You may not experience dramatic weight gain. You may not feel profoundly exhausted. Instead, you might notice several subtle changes: feeling colder than usual, dry skin, slower thinking, lower energy, changes in bowel habits, and perhaps persistent throat symptoms that do not seem to have an obvious local explanation. Sometimes people spend months trying throat sprays, lozenges, or other remedies without investigating whether an underlying medical issue could be contributing. This is why persistent or unexplained symptoms deserve a conversation with a healthcare professional. A basic blood test can evaluate thyroid function. Common tests include TSH and free T4. If you have never had your thyroid checked, or if it has been a long time since it was evaluated, you can ask your doctor whether testing makes sense based on your symptoms and medical history. This does not mean thyroid dysfunction is the cause of everyone's throat mucus. It means it is one possible contributor that should not automatically be overlooked. And there is another group for whom thyroid changes deserve particular attention. Women in later adulthood can experience changes in thyroid function, and symptoms may sometimes overlap with changes that are simply attributed to getting older. So if persistent throat symptoms are accompanied by several other unexplained changes in how you feel, bring the complete picture to your doctor. Sometimes the most useful treatment for a throat symptom is not another throat product. Sometimes it is identifying what is happening elsewhere in the body. If this connection surprised you, type 3 in the comments. And if you have been finding this information useful, consider subscribing so you can continue learning about practical ways to protect your health as you get older. We are now moving to cause number 4, and this one involves something that is sitting on your plate, but probably not the food you immediately suspect. Cause 4, histamine intolerance, when food can mimic an allergic reaction. Let me describe a situation that many people find confusing. Someone says, "I don't have food allergies. I was tested." But then they notice something strange. Certain meals seem to make their throat feel worse. Maybe it happens after a glass of wine. Maybe after aged cheese. Maybe after tomatoes. Maybe after eating leftovers. Their throat feels thicker, they clear it more often, and sometimes the symptoms do not appear immediately. If that pattern sounds familiar, histamine may be worth discussing with a healthcare professional. Histamine is a naturally occurring compound involved in immune responses. It is also found in varying amounts in certain foods. Your body has mechanisms for breaking histamine down, including an enzyme called diamine oxidase, or DAO. But the way people process histamine can vary. Digestive health, medications, individual biology, and other factors may influence how someone responds. This is important because histamine-related symptoms can sometimes resemble allergies without being a classic food allergy. Foods commonly associated with higher histamine levels or histamine-related reactions include fermented products, aged cheeses, cured or smoked meats, wine, and certain other foods. Some people also report symptoms after foods such as tomatoes, spinach, or avocado, and leftovers can become relevant because histamine levels may increase as certain foods are stored for longer periods. For someone who is sensitive, the timing can make the connection difficult to see. You eat dinner, nothing happens immediately, then a few hours later your throat feels different. You go to bed, the next morning you wake up with more mucus, and you blame the weather, or aging, or your sinuses. You never connect it to dinner. This is one reason a short, carefully monitored dietary experiment may sometimes be useful. Not a permanent elimination diet, not starving yourself, and not removing dozens of foods forever. Instead, if your healthcare professional agrees, you could track your symptoms for a limited period while reducing several commonly suspected high histamine foods. Keep a simple record. Write down what you ate. Write down when you ate it, then rate your morning throat symptoms from 1 to 10. The goal is not to follow a restrictive diet indefinitely. The goal is to gather information about your own pattern. If a specific food repeatedly appears before worsening symptoms, that gives you something concrete to discuss with a qualified professional. And remember, food reactions can be complicated. Do not assume every reaction is histamine intolerance. A true food allergy, reflux, medication effects, or another condition can produce overlapping symptoms. Now we have reached the fifth cause, and I intentionally saved this one for last, because it helps explain why some people continue clearing their throat even after they have addressed several obvious triggers. Cause 5, laryngeal and vagal hypersensitivity, the nervous system loop. At the beginning of this video, we talked about the throat clearing cycle. You feel mucus, you clear your throat, the tissue becomes irritated. The irritation creates more sensation. You feel something again. So you clear your throat. But there may be another layer to this problem. Your nervous system. The vagus nerve is one of the body's major nerves. It travels from the brainstem through the neck and into the chest and abdomen. It plays roles in many functions, including digestion, heart regulation, breathing, and communication between the brain and various organs. The nerves supplying the throat and voice box also play an important role in how you perceive sensations in this area. For some people with persistent throat symptoms, the tissues and nerves of the larynx can become unusually sensitive. This is often described as laryngeal hypersensitivity. Imagine that the sensitivity dial in your throat has been turned up too high. A sensation that normally would not bother you suddenly feels significant. A small amount of mucus feels like a large obstruction. A slight change in temperature feels irritating. A little dryness triggers the urge to cough. And once you respond by repeatedly clearing your throat, the cycle can become even stronger. This is one reason why someone can continue experiencing throat symptoms even after the original trigger has disappeared. The nervous system may have learned to react too strongly. This is also why simply using another spray or lozenge may not always solve the underlying problem. Those products may temporarily reduce the sensation, but if the nervous system remains highly sensitive, the cycle can restart. Approaches used for persistent laryngeal hypersensitivity can include breathing techniques, behavioral strategies, and in appropriate cases, speech-language therapy focused on reducing throat irritation and controlling the urge to cough or clear the throat. The goal is not simply to suppress a symptom. The goal is to teach the throat and nervous system to respond less dramatically to harmless sensations. One technique often used in breathing exercises involves making the exhalation longer than the inhalation. For example, slowly inhale through your nose for about 4 seconds, then gently exhale for about 6 to 8 seconds. The breathing should be comfortable. Do not force it. And if nasal breathing is difficult or you have a medical condition affecting your breathing, discuss appropriate breathing exercises with a professional. Consistency matters more than intensity. A few calm minutes every day can be more useful than doing an aggressive exercise once in a while. Before we get to the action plan, there is something very important I do not want you to overlook. Most of the causes we have discussed can be relatively manageable, but persistent throat symptoms can sometimes signal a condition that needs medical evaluation. Please speak with a healthcare professional promptly if you notice blood in your mucus, increasing difficulty swallowing, unexplained weight loss, a persistent lump or swelling in your neck, or hoarseness, or a significant voice change that lasts for more than 3 weeks. These symptoms should not simply be managed at home. They deserve proper evaluation. Now let's move into the practical action plan. Here are several things you can consider. Step 1. Pay attention to nighttime breathing. If you regularly wake with an extremely dry mouth, investigate whether you are breathing through your mouth while sleeping. Do not automatically assume that mouth taping is safe for everyone. If you have nasal obstruction, significant snoring, suspected sleep apnea, breathing problems, or other medical conditions, speak with a healthcare professional before trying any technique that restricts mouth opening during sleep. The first priority is making sure you can breathe comfortably and safely through your nose. If snoring is severe or you frequently wake gasping or choking, ask about evaluation for sleep apnea. Step 2. Check your home environment. Consider purchasing a simple hygrometer so you can see the humidity level in your bedroom. A commonly recommended indoor range is roughly 40% to 60%, although the ideal level can vary depending on the individual and environment. If the air is extremely dry, appropriate humidification may help reduce airway dryness. But remember that humidifiers also need proper cleaning. A dirty humidifier can introduce unwanted particles or microorganisms into the air. Reduce unnecessary fragrances and strong chemical products in the rooms where you spend the most time. Check your HVAC filters. Make sure air conditioning units are maintained, and investigate persistent dampness or musty odors. Step 3. Discuss thyroid testing with your doctor. If your throat symptoms are persistent and you also notice things such as unusual fatigue, cold sensitivity, dry skin, or other unexplained changes, ask your doctor whether thyroid testing is appropriate. TSH and free T4 are commonly used to evaluate thyroid function. Do not diagnose yourself based on throat mucus alone. Give your healthcare provider the complete picture. Step 4. Track possible food triggers. If you suspect certain foods may be making your symptoms worse, keep a simple 2-week food and symptom diary. Write down your meals. Record the timing. Then rate your morning throat symptoms from 1 to 10. If you want to experiment with reducing suspected high histamine foods, discuss the approach with a qualified healthcare professional, particularly if you have other medical conditions or take regular medications. The purpose is to learn your personal pattern, not to permanently restrict your diet without a reason. Step 5. Practice calm, controlled breathing. Try sitting comfortably. Inhale gently through your nose for approximately 4 seconds. Then slowly exhale for 6 to 8 seconds through relaxed or slightly pursed lips. Continue for about 5 minutes if it feels comfortable. Do not strain. Do not hold your breath unnecessarily. The goal is relaxed, controlled breathing rather than forcing the nervous system into a particular state. Regular practice may help some people manage breathing patterns and reduce the urge to react to throat sensations. Step 6. Change the way you clear your throat. This may be one of the simplest changes you can make. Try to avoid the harsh, forceful throat clear whenever possible. Instead, swallow gently. You can also try a soft, controlled cough or a quiet sound when you feel the urge. The goal is to reduce the mechanical irritation caused by repeated aggressive throat clearing. At first, this may feel unnatural. You have probably been clearing your throat automatically for years. But every time you replace a forceful throat clear with a gentler response, you are interrupting the cycle. Let me leave you with this. A lot of people reach their later years and simply assume that persistent throat mucus is something they have to live with. They blame aging, they blame their sinuses, they blame the weather, but persistent throat symptoms can have multiple contributing factors. nighttime mouth breathing, indoor air conditions, thyroid function, possible food-related reactions, and increased sensitivity within the throat and nervous system. The important thing is not to assume that one of these is definitely your cause. Instead, pay attention to patterns, look for triggers, track what changes, and when symptoms persist, involve a qualified healthcare professional rather than trying to diagnose yourself. Your body is constantly giving you information. Sometimes the key is simply learning how to recognize the pattern. If you found this video helpful, subscribe for more practical health information designed to help you understand the changes that can come with aging. And in the next video, we will look at another overlooked factor that can influence airway irritation and persistent throat symptoms. You may be surprised by how connected the pieces really are.